Welcome to Canter Therapy Podcast. I'm Dr. Shelley Appleton. Before we begin today's episode, I want to encourage you to listen with an open mind. This conversation genuinely changed the way I think about a group of horses I'd honestly never considered in this depth before. Dr. Jane Clothier has spent years researching premature and developmentally immature foals, asking an important question that few people have explored. What happens after these foals survive? Her work reveals how events during the final weeks of pregnancy may influence skeletal development, stress regulation, behaviour, learning, and soundness for years to come. Whether you're a breeder, a trainer, a veterinarian, a therapist, or simply someone who loves horses, this episode offers a fascinating perspective that may help explain why some horses struggle despite receiving excellent care and training. It's one of those conversations that leaves you looking at horses differently. I hope you enjoyed this conversation as much as Kat and I did. Good evening, Kat.
Good evening, Shelley. How are you this evening?
I am very good because 2026 is been a fantastic year for some pretty extraordinary guests. So I'd like to introduce you to Jane Clothier. Good evening.
Hello. Thank you for joining us on the podcast, Jane. It's so lovely to finally meet you. This doesn't really count as in person.
And by the end of the podcast, everyone is going to realise why this is such a cool podcast. Okay, so Jane, I'm going to read you your introduction. Okay, so today we are joined by Dr. Jane Clothier, an equine musculoskeletal therapist, researcher and author whose work has brought serious attention to the topic many of us have not thought deeply enough about, and that is so true. Everyone's going to be blown away by this. Jane completed her PhD at the University of New England in collaboration with the CSIRO Animal Behaviour and Welfare Group, focusing on equine prematurity and developmental immaturity. See, I didn't even know about that, Jay. That didn't cross my radar. Anyway, we go on. Her research looks beyond neonatal survival and asks a more uncomfortable and important question. What are the long-term skeletal and functional consequences of these horses? Many premature and dysmature foals survive these critical early weeks. But what happens months or years later when they are asked to grow, train, perform, and carry a rider? So Jane translated her research into a new book, Managing the Miracle Foal, which provides practical, evidence-based guidance for owners and breeders navigating the long-term development of these horses. So this conversation is not just about breeding. It's about biomechanics, welfare, training timelines, and understanding the horse that's in front of us more deeply. So Jane, welcome. We're very Did you like my intro?
That was huge.
Look, I had to get it on because you're such a fascinating person. This is such a fascinating topic.
Must be the one I actually did, I think. Good. Yeah. I think that's what PhDs do, if I'm correct.
No.
This one seemed to.
The good old PhD. All right, I'm going to kick off. I'm going to kick off with this question here, and you'll probably be able to tell us a bit of background about yourself to answer this. So, Jane, what led you to focus your PhD on premature and dysmature foals?
Oh, okay. The origin story.
Yes, it's the origin story.
Yeah. Well, I was working as a body worker. I came to Australia in 2007 and I've been working as a body worker, doing extra bodywork courses as you do, expanding outwards, developing your knowledge and skills. And I was kind of reaching that point where I wasn't sure what else I wanted to do next. At the same time, my origin story takes me back to a particular horse when I was doing body work. And I was getting the feeling like this horse is just the same every time. This feels like the first time every time. Now, why aren't we getting that connection? The sort of body work I do, like, lots of people, it's kind of subtle and very like myofascial based, and as well as other things. And the horse normally responds, and they might hold back, for instance, say in the first session, but then the second session, they've got the idea, they've had the afterglow, as I call it, and they're kind of like, oh, hello again. And, you start to get that little connection happening, and they sort of melt into it a lot more most of them are first time, I'll say, but, you do get those that hold back and have a good think about it. And this particular horse wasn't getting anywhere. And at the same time, the owner had to say, oh, this horse is premature. I then watched a TV program, which was about chronic pain in people who had been premature babies. It was a documentary that was based on some new research that had come out. And I can remember the moment just sitting there watching the TV, and so I'm still in the Northern Rivers, New South Wales, near Livermore, and just thinking, oh, as you do, that's a thought, that noise.
All those dots.
And just, sort of thinking, well, what is this? And it was about the inability to tell the difference between benign, beneficial touch and malignant touch, negative touch. The word's gone that they used right at this moment. And it's to do with being needled a lot, all those sort of little heel lancets and things that you do to babies when they're born. And it's because the nervous system is just still in that state of flux, that immediately sort of postnatal period. And for these babies, it probably, it amounts to sort of prenatal in other babies. And I was just kind of like, oh my God, it's something there. And I just started thinking about that while I was working on horses and sort of noticing more and more. And it's the first time I sort of looked from that point of view. And I was then inclined to approach somebody I knew who knew about master's degrees by research. So I was then feeling that's what I wanted to do. I'd also met a premature foal at that point who stood up and her legs were bending backwards. And I was kind of like, oh my God, I started reading and, what's happening here, obviously that is an area that is known about, and we'll come to that. But then I sort of sidled into a master's and I was lucky enough to get a studentship at CSIRO, which meant I get to sit in their offices and learn from all these great scientists and animal scientists around me. And sort of started, sort of doing your literature reviews, sort of found a bit through that. I started doing some tests, or they call them experiments, which sounds awful. This word everybody freaks out about, but it's just setting up tests so you can isolate cause and effect. And for a whole year, didn't get any results at all. This is like the test of a PhD, master's as it was then. But then I did sort of get more on target. So I was looking at reactivity to start with. And that sort of then took me into things such as the adrenal glands and cortisol.
Yeah. So you had to find something
and
to
I
measure.
kind of had to find a way into the top.
Yeah.
And I was very lucky because being at CSIRO, or CSIRO, as the insiders call it, I was with a lot of scientists who look at things cross-species. And that is really important here, that you're looking at not only humans, but what's happening in production animals. Because in production animals, this has a huge economic impact. If they don't develop properly, you've got less meat. Is the sort of the sort of bottom line on that. But then it was, being in a welfare group, also looking at the animals' resilience, looking at chronic pain that they experience. And so I started learning from other species as well. And I honestly don't think I would have got through without that. That was a really positive force. And then, did start to sort of find things and to find results. And they sort of moved on from there. And it kind of grew and grew. And then I transferred to a PhD at the University of New England. So
just to ask you a bit of question about that.
Yeah.
Sorry, Kat.
Don't worry, I can't.
So was this your own project? Did you find, go talk to a supervisor and pitch your project?
Yes, I was very lucky to get an excellent supervisor, somebody who championed me at CSIRO, who's still there for me as a person. And I've got to say, she has horses as well. So we've obviously got that in common. And, we talked with her, and then the professor at in the animal science department at UNE, and two people there. So I had two, Wendy Brown and Jeff Hinch at UNE, and then Dr. Alison Small at CSIRO.
That's awesome. Can we backtrack a little?
Enormously.
Backtrack a little bit. Can you define for us premature and dismature foals and what that means to you?
Yeah, well, that's a cold can of worms, really, because, horses have such a long gestation period. It's so variable anyway. It's sort of in the 60s to 80s, it was formalised as being below 320 days is premature. And what you call normal range is 320 to 360 days, or 365. But every case is different. So those are approximate guidelines. And of course, they were set before, when people only ever took the sort of gestation date from the cervix of the mare. Whereas there's different ways of measuring now with ultrasound. So one of the things I found very quickly, sort of going through the literature that's already published, was the variability. There is some variability between breeds, and the factor that I found was also latitude. So sort of ambient temperature, the localized climate makes it, or weather conditions makes a difference as well. So in Australia, I was going up to Queensland, southeast Queensland, and meeting all these foals that had been born at sort of 310 and 315 days that were actually quite good, because so
warmer and
that also goes with months of gestation and conception as well. Sort of summer foals tend to be shorter than winter foals, winter conceptions and births.
So what defines a premature? What is the definition of a premature foal?
You've got particular signs, and this is where, as I say, frequently there's a blurred line. Dismature is sort of normal range gestation, so it's like 320 days onwards, but they can have signs of prematurity as well. And your classic signs are the domed forehead, and this is why a lot of Arabs slip through the net. There's a lot of Welsh ponies because they tend to have them anyway in the diminutive faces. But it's the domed head, silky coat, floppy ears, laxity in the tendons, and just generally weak. Those are the main features that are sort of recognisable, visible. So
any
and small,
with
small.
Any horse with those signs when they're born would be classed as premature or dismature.
So they tend not to be. I mean, sort of laxity, sort of we should call it, digital hyperextension. So which you'll know about that. So, that is quite common. And in Australia, and this is another thing I've noticed, this is just because I was still going out and working on horses. I did my PhD part-time. So I was still practicing. And so there was this kind of flow between what I was learning and what I was seeing. And I was, going from one to the other. But sort of I would find, with horses, when I can go and see them and I think, I'm not sure about those hocks and knees, which is one of the less visible conditions, incomplete ossification, when they're born. With adult horses, then say, so where were they bred? And it's very often out west or like northern Queensland or somewhere where you can possibly say that nutrition hasn't been optimal sort of during gestation. So that can link very strongly to dysmaturity.
Yeah. So when we're talking about that, we're talking about foals down on their bumpers or knock knees and things like that.
Yeah. I mean, you have the periarticular laxity, you can call it, or digital hyperextension, and then some are sort of got contracture, so it's so-called contracted tendons. But,
how could we describe that to someone that doesn't know what that means? What would be a layman's description for that?
A layman's description. I mean, you used it. You said sort of down on the bum.
Down on the bumpers.
Laxity.
Crooked legs.
Crooked legs.
So crooked legs. I mean, I sort of briefly mentioned, one of the less visible things, which is incomplete ossification, which is the bones just aren't developed enough at birth. When you think about it, foals, they've got their huge long legs, the survival, sort of the neonatal foal and neonatal foal. And, they have to be within the uterus, they have to get out of the uterus and they have to stand. So they have this long lower leg, but they also have sort of very underdeveloped knee and hock bones. So carpals and tarsals. And my sort of thought is that makes everything very flexible and, sort of improves their chances of exiting and landing without serious damage. Doesn't always work, of course. But sort of particularly in these premature and then also dysmature foals, particularly where they're sort of had nutritional challenges, not enough formation has happened in those bones, which develop very late in gestation.
Yeah.
Is that making sense?
No,
you don't.
Thoughts a bit.
It's hard sometimes to take science and then put it in really easy to understand terms. So hopefully we can.
It's hard to go back to the beginning as well. I think, well,
I'll tell you what I'll do.
I'll say now.
Can I say, so a premature foal, we can say that's really done on days of gestation, and dysmaturity is where they come out, but they've got signs of immaturity.
Yeah.
So even though they might have gone the time, because that's the whole thing about studying your work is like so much for the gestation time that's just depends. They still can make.
It all depends.
It just they can come out on the right time at the right day.
And some of them go over a year, and you can have sort of like post-mature, which is well beyond your 360 days. But they're sort of they're long and tall horses, but they're weak, and so they can have developmental issues as well. Not always, and that's what's really important is that the things we talk about. There's this variability. And I would sort of say some will have some of the issues, some will have none, some will have a lot, and that's the same in people as well.
Yeah, absolutely.
It's completely okay. But then when I was at CSIRO and some students had come around from UNE who were doing animal science undergraduate, were having to do CSIRO, there's very often somebody would step forward and say, "Oh, no, I was premature, and this is making a lot of sense to me."
Yeah.
And that's very humbling.
Yeah. So our next question is this. So which body systems are most vulnerable when a foal is developmentally immature?
Yes. So the endocrine systems, which I know you know about, sort of being trained as well. But this is one of the things that's very quickly started to sort of pin my research down, was the learning about actually from this group of scientists that did a lot of research under Peter Rossdale, who was one of the greats, who I read an awful lot of during my studies. But they looked at the systems that were affected in prematurity, and they did a lot of experiments that you would not do today, ethically. But at the same time, thank goodness they did, because it's given a whole sort of bedrock of information in horses. And the system that is the endocrine system, so it's the HPA axis, and this is hypothalamic pituitary adrenal axis, is talking too quickly again, which is basically your stress response. Your adrenocortical stress response is governed by this. And the adrenal gland itself, because it's not needed much in the gestational period, develops very late. And the adrenal cortex in particular develops after day 300. This is a date that's given. Obviously, as we know, it's variable. So it's been shown in research as developing after day 300. So there was a lot of research, say, done in sheep that shows that then it's catch up once they're born. But that's critical.
So the whole stress response, the whole systems that involve with that actually only develops very late in gestation.
Yes.
And so then, of course, when they're born as well, if they're immature or they're premi, then there can be a delay in the development of that system.
Yes, and this is back to the malignant versus benign touch again. That difficulty in differentiating, because you've got all these releases of, sort of hormones, basically your biochemistry and your field. So you have to have certain amounts that balance out, and that's when we have sort of, what we call homeostasis commonly. Everything's working in balance. We don't even have to think about it. But those ratios can be out. They can be off. So you've got, basically things such as, your ACTH release leading to, cortisol, adrenaline release, and your negative feedback loop, which is when it all switches off. So you've got a stress system that either isn't firing up enough or, is switching off.
Overfiring or,
wow.
It's constantly a bit on.
So besides the musculoskeletal issues we talked about,
skeletal system as well.
We've also got the endocrine system as well, and in particular the stress response. It's even being developed late in gestation, but then if they're born early or born immature, that cannot be developed properly. So it has these
it's a bit clunky
effects. Wow.
It's a mistiming in the engine, it's
wow.
So it has a massive effect on horses. Can you tell us, what did your research reveal about the long-term musculoskeletal development in these horses?
Yeah, I mean, my sort of incomplete ossification is known about, definitely. But once you start introducing the HPA axis and the adrenal gland as well, you also have aldosterone. the hormone that relates to your renin, angiotensin, aldosterone, and I've got the RAA system, which is basically your kidneys, and calcium regulation. So, if we have, say, if my calcium was too low, I'd get high blood pressure and I might get palpitations. And we sort of know with horses that they can get muscular excitability. So everything gets tight, too tense, and, there's that whole excitability, and that's coming back into that reactivity that I was talking about and thinking about. So back to aldosterone, off with spin again. Back to aldosterone. I mean, once you have calcium dysregulation, you have all this potential for, bone development issues.
Yes.
So potentially with I haven't even gone into that yet. This is where everything's very circular when you talk about this level of foundational to development. But basically, when you have your incomplete ossification, very often, you have your angular limb deviations or deformities, so your knock knees in particular, but also your tarsal, your hock valgus as well, which is cow hocks or sickle hocks together at the same time. Sometimes those are more likely to develop, and so already through loading, you're setting up a scenario for arthritis. But then the body and the systems themselves are sort of not governing calcium correctly, and you're also sort of prone to arthritis from that direction as well.
Yeah, wow.
As well as
go on.
So osteopenia, so actually your bone mineral density can be different.
Wow.
Too.
So in a nutshell, your calcium metabolism can all be messed up from it, or your use of calcium within the body. You can get
everything does.
Bone formation can and bone density and strength and development can be all messed up.
And again, we've got to say it's not every horse and that has all of them. I had a couple in my research that most likely did though.
Okay. Wow.
Down to
Wow. So it's, you're right. Because it's all big feedback loops and it's a complex system where one thing affects something else, there's just this big ramification. I could suppose we could probably sit you there and come up with another 63 things that'd be relevant to it as well.
And, it's, and for Kat as well, I just sort of looking at this Arabian who was with me for 5 years and he had 4 massively different hooves and considerable degradation. 2 of his carpal bones were fused together. Still looking at him. But a lot of people didn't see anything wrong with him. They would look at him or talk about his reactivity and say, well, he's an Arab. And this is what happens when they're not obvious. He was never ridden. It would have become obvious if he'd been ridden quite quickly, I think. But, we're talking about the dismature, so the ones that he was premature. He was 305 days.
Oh, wow.
But you're sort of looking, we've kind of got this panoply of stress, if you like, there's their inner stress that's coming from the things their body is struggling with. They've got the management, the way they're fed, the way they're looked after. You could just go on and on.
Yeah, wow.
I was envious of mine at CSIRO. My fellow sort of PhDers who were doing sheep, and they had the identical sheep in a paddock.
And you got a lot of numbers as well when it comes to production.
They're all born within about a month.
Wow.
With the horses, we have that variable.
Yeah. So it has this profound effect on their structural integrity, I suppose we'd call it. Their bones, ligaments, tendons, as well as their whole electrical wiring as well. Their nervous system, everything is really impacted. So, Jane, when these horses enter training, they grow up and people look at them and think there's nothing wrong with them, and they enter training. How might early developmental immaturity start to show up?
The thing that I'm kind of obsessed with, my bodywork clients would attest to this, is the hocks. Everyone looks at the front legs. And I think it's because the deviation, when you have, your knock-knees or your carpal valgus, as it is called, or sometimes your toe in, toe out, but it's going against the usual direction of the joints that you normally see. Whereas with the hocks, it's a cow hocked. And you have a tarsal valgus, which is that sort of presentation, but then they're tilting back and setting up for negative plantar angles, which you hear a lot more about these days.
Yeah,
those things often go together, and then of course the back and
so it's all connected.
All of those sprains, and you get all of that secondary sort of.
Yeah, so people just shrug. It's just the horse's confirmation, Jane. It's just this confirmation.
They see it. It's or you see that, or it's a bit subtle. And it's only later that I just included, just to mention the book, because it takes ages to go through all the photos and prepare photos. So I did a last minute one, and it was from a pre-purchase exam that somebody had done of a 4-year-old. And what's happened is those lower, it's the same bones that usually get affected by arthritis in horses, but the horses fall. And I've seen it in, a 6 or 8-year-olds as well. They're already fusing up, and they're already, the joint spaces are closed, and they're early onset arthritis.
Yeah, wow.
That's why I didn't quite get that out earlier, but yeah.
Yeah, no,
That's where they're heading towards. And you can see that. Obviously, you can't see that without X-rays, but you can see that presentation that's not right in the hind legs.
Yeah. So you'd be able to see confirmationally there might be some issues there. What are some other developmental things that you might see?
About confirmation.
Pardon?
I haven't talked about ovary confirmation.
Sorry, Jane was just trying to extract all the information.
Half an hour gone already. My goodness.
It's all right.
Really interesting thing.
Go for it.
That I found. So I was comparing horses in this studies, horses that were premature or dismature against siblings. So I had to find them where somebody was breeding and had a family group, basically. And it's imperfect. You can't, all these variations and variances in horses. It's very hard to find where people have had them over the longer term like that. I always say to people, ask about that cheap horse that comes from a good stud. Why is this foal so cheap? Just throw that in there, say no more than that. But yes, the actual difference, they're very often, particularly the prematures, they're small. But I've managed to statistically show by looking at their ratios, by measuring a whole load of different ratios, basically on confirmation photos, best I could get, that the part that is small and that accounts for their lack of height is mostly below the knee and hock.
Wow.
So if you think about it, that part of the body that is usually close to full length when the foal is born. So they're being born before that has developed enough. And also when growth plates are a lot more open than they would be. And this is the other side compared to, incomplete ossification. And there's something called a skeletal ossification index, which looks at the degree of ossification in foals. And it's not just the carpals and tarsals, but also those growth plates lower down the leg. And sometimes the one directly beneath the knee is open when it should be closed, because that has to do a lot of supporting. So that's an extreme prematures. But people sort of have this idea, well, they'll get up once they're standing up and running around, that's really good. But actually, these foals, they should be resting. And
oh, wow, really?
Time.
Yeah, wow.
If so you get the vet out. This is always the message, get the vet out.
Yeah. Well, that's why your book as well is so vital, because it gives this practical information in it. We'll talk more so people know where to access this book. But I think anyone that goes and buys a horse or trains horses needs to know about this very important information, because that's not what you think, oh, great, being confined for its period of time. Off we go, run, move those legs. Not necessarily best.
Yes, and I'm sure experienced breeders don't do that, but a lot of foals are born all over the place.
Yeah, they're born. People breed their own. They breed their own foals. Yeah,
breeding establishments.
Yeah. True. Yeah. So, what else can go wrong in those early? Anything else you can think of? Any developmental things that might come up when a horse starts being worked?
When a horse starts being worked, is there? This is something, I have lots of things in sort of my PhD, there's the studies that you get published, small number, in like journals. And then there's your studies that you get results. They go into the PhD thesis, but they say you haven't got enough evidence to take it to a journal and publish it there. But it's still sort of, look, I found this.
Yeah.
Really immersed in this research. And then you have the more anecdotal stuff, what I call sort of anecdata, which is not my invention, but it's a great word because you're doing it in that research context. You're hearing these things and noticing them. And, sort of things like temperament come under that. I just did a small questionnaire for owners about what applied to the research foal, now a horse, and the siblings or part siblings, and that would show up the differences. But one of the things that was actually said to me frequently was this thing about they just don't seem to learn the same way. That's not something I could go into. I'm not a behaviourist. There are lots of these things came up. And eventually you have to decide, I've got to write a thesis here. You can only do so much, and I'm not an expert enough. I'm sort of a body worker. That's where I come from. But there was this point that there's a possibility of cognitive issues. And and hear it again and again, that people would show the horse something and go back the next day. And it was like it hadn't happened. And I had a really, really interesting experience again with this little Arabian who was with me. I made a significant change to his nutrition. And suddenly he remembered a lot that I knew his owner had taught him. And that was pretty remarkable.
Yeah. Did you have a hypothesis for this? What was your
I think it came down to the calcium needs.
Yeah, okay.
Again, I gave him a very high quality, expensive calcium supplement, chelated calcium, and he changed a lot. This was a horse who would speak at his own tail. If I groomed his tail, I would go, "Oh, what was that?" When he first came to me, and of course he'd been groomed loads of times. And I knew his breeder who had done a lot of really good work with handling and training. She was very much sort of, the right sort of person to be looking after a foal like this. But I sort of believe that sort of what in a lot of nutritional guidance, it's based on the normal range, and these guys are the outliers in the data. And you might get one of them pops up in the data and they get removed because it's going to skew the whole result.
Yeah.
So I think it's possible, just in my view, and this is not evidence, but it's possible that these guys have much higher needs for certain nutritions. And I believe that.
Yeah, that's really fascinating. Can I just ask you another thing about, because I train horses.
I'm not saying calcium will fix them all.
No. This is actually more of a training thing. So, you get a horse when they're nearly like 3.5, 4. Should I backtrack and say, do you have a strong opinion now from doing this research that the age horses should be started? Because, there's controversy about that. There's the science, and then there's the virtue signalers that think they should wait until they're 7, things like that. Do you have an opinion about that? The age of starting horses?
Well, for me, I just think they need longer. That's just my feeling about it all, to be honest. I think they need, their musculoskeletally, they can have challenges. I think that they need that bit longer to develop.
Yeah.
In my view.
So this is,
I don't think they're slower developing.
Yeah.
It's that thing, sort of with the legs and the difference in the ratios. I don't know what starts that. That clock ticking.
Clock ticking. So this is my thought. So with them, because they're immature, because I just note some things that I've come to realize that we might not be, there's an old concept called legging a horse up, by being able to leg them up, doing a lot of movement before you go putting a rider on the back, beyond just doing circles in a round yard or on the end of a lunge thing, actually legging a horse up. And because I've been looking at cases, and it's interesting, you've been talking about things like, I've got to find out about that horse, got to find out about that horse's history. Because I have a lot of horses that are incredibly well cared for on every level, well bred, came from good studs with good upbringings, and then developed arthritis very young. And so that thing that you said is really interesting. And what I had worked out before, like you put this on my table and my desk and revealed this, I just thought maybe they weren't legged up enough. What are your thoughts on that?
Oh,
preparing those bones and ligaments.
Yes, I mean, we've got the bone
movement.
density, and I'm just thinking while you're saying that, if we can get everything right for these guys when they are really young, we can benefit them a lot. The skeleton I've just been looking at, he had a lot that was right, but not enough for his condition because nobody knew. He looked fine. I can't believe it's always this thing with skeletons that you're sort of what they were hiding. You think, oh my goodness. But particularly in his case. And I know with osteopenia, it's kind of your middle ground and it can go to osteoporosis. Once you get to osteoporosis, you can't get it back. With osteopenia, you can still influence the bone development. And I'm no expert on that. But all my reading, and this older women know about this kind of thing, and people who work with older women, you need to get that stuff in, get the goodness in before you hit that point. I think we can probably make a huge difference to them by early intervention. So that would sort of figure that before you get to that really bad point, if you're doing it nutritionally right, then if you're talking about just strengthening them, and introducing them very slowly, that could be a good thing.
Yeah, it's just that old concept that's kind of being lost, legging them up. There's, endurance people might know about the concept, some eventing people might know about, but back in the day there was a lot more kind of ponying horses out and getting them to do just.
So we know that improves bone density.
Yes, So I'm just
loading.
Yeah.
But that's loading without somebody on the back.
Yes, not just the movement. Needed to prepare the horse before you then go and start putting them more to specific work for under saddle. Really interesting what you said there, because it's interesting those horses that have got juvenile, young. Getting arthritis at 4, 5, 6, or horrified when they're 7 and they've got the most horrendous arthritis. And you always think, how did that happen? Because they weren't, they weren't thoroughbreds, or they weren't put through 2-year-old classes or whatever. Some of them were started at 4 or 5. In fact, sometimes they started later and, and they still had arthritis. So it's really good. It's made me want to delve into those cases to find out about what kind of foals, what happened with their foaling.
Yeah, and you can sort of have the worst case scenario, which I do get to see, unfortunately, around here because I'm sort of inland a bit. Working horses that have been bred on stations, so stock horses and quarter horses, and a lot of them are fine. You do get the ones where nutrition hasn't been right, and they've been doing wheelbacks, for instance, 2 years old. They have very gnarly hocks.
Yeah, interesting.
So, careful what you say there. I'm not picking out one particular group, but...
Oh, no. Every single group has gold of information and some kind of risk of what they do. So, Kat, you got a question?
I sure do. I think we've kind of been touching on it, but what are the most important management factors that influence long-term outcomes?
For me, I think, the nutrition. Yeah, definitely. I think hoof care is huge. And again, I'm talking about this guy who's got 4 completely different size hooves, affected him his whole life. And he had brilliant trimming and they were looking great, but you still have this sort of sorry state inside in the pedal bones. I'm also really, I think a lot about the sesamoids and the navicular as well. And I think about that with laxity, and it's there are so many pressures through the body that can arise from this, all the secondary effects. And so, for me, good hoof management from a really young age is, I've sort of been talking to a vet recently down on the coast, Lauren Jones, who's, started doing a lot of using Dalric shoes and the extensions and addressing angular limb deviations that way in the very young foals. And the benefit of doing that so early, you're affecting the angular limb deviations at the earliest. I avoid using the word deformities because it tends to bite people. But, these deviations that can be addressed quite early on. I think it's critical, and with the feeding, getting the mineralization right, so the bodies have a chance to develop. I think there's always going to be a certain amount that's missing because it is such a fundamental development issue, affecting different systems. But there are things that can be done. You can make it as good as possible for that.
As good as possible, yeah.
Yeah, I think what you've really done a good case for of how important it is to identify these foals, because they need this special care, because it's pointless waiting till they're 4. Like when I presented to them and they got really terrible arthritis, like, well, not much you can do about that. Like we can kind of try to resurrect them.
Horse doesn't like work.
Put them together, and just whatever. The crucial time is when they're a foal. And identifying these issues and doing these management practices to try, this is your time period where you can make a big impact on them. I think that's what you've been so good at spelling out. It's all good. I'm all interested, right? It's like, give me something else I can pick up as a reason for a horse struggling with its training or going unsound. Give me something. But really, that's not the thing. It's like, no, identify it. Deal with it at that point. Get the awareness out there that this has significance and this can result in training or soundness failure down the track.
For sure.
Yeah, because it's so funny. Until a couple of days ago when I started going through your work, horses with wonky limbs, it was just like, fix those wonky limbs up and look, they're all straight. Sweet. Off we go. Nothing. That's where my kind of knowledge ended. It was like we made them all straight and nice. We put those little extensions on their feet and everything. Beaut. There we go. Look at that. Done.
Yeah. And I just think the hocks.
Yeah.
More people start to see the hocks, the better. Because I find that is, people, like I said, people spot the front legs, but not the hind legs. And I've even come across somebody being told their show jumping bred foal that was premature. Every chance they'll have a sporting career. And I said, did they x-ray the hocks? She said, no. They x-rayed the hocks and they were collapsing.
Yeah. Wow.
Yeah. You have to be the advocate for your horse, is what I'm going to phrase that.
All right, Kat, I'll let you ask a question because I've been dominating. As usual with my curiosity. Sorry.
You're just passionate. I love it.
I am. I love it. So fascinating.
The 2-bottle of wine discussion.
Yeah. So and just stay for a week.
Yeah. We can do that. We would have so much fun, Charlie, if we just sat on Zoom for a whole weekend and people could drop in as they wanted and we could just have chats
with their glass. Yeah.
And they wouldn't get out. We'd stick with it. We wouldn't let Jane out. Jane would be trapped for the whole weekend.
Okay. So has improved neonatal care changed the population of horses reaching training age?
And there's a lot more survivors now. Veterinary medicine's moved on so much.
Yeah.
It's there was this. I still hear about it sometimes. There's the view that, see if the foal's still alive in the morning, then we'll treat. Yeah. When they're sort of very premature. Obviously, this is not the case with dismatures. And, sometimes there's different views on whether it's worth doing or not. And I don't mean that in a nasty way, but it's hugely expensive.
Mm-hmm. And hugely expensive.
Is available.
When
you're going to spend $10,000 or more and your horse has a life of pain, and I'm not, I don't mean that in a cruel way, but I think if you are going to do that, you need to be ready to do everything else. I've not put that together before.
Yeah.
Discussion, but I think that's how it should be.
No, it's a massive legitimate welfare consideration.
It's just starting,
Yeah.
It is. I mean, for a lot of people, it's hugely expensive and they think the foal is going to be completely okay. You just get through that. It survived. And that's why I've called it this miracle foal. And my sort of thesis is called Managing the Miracle Foal, because everyone calls them miracles. It's a miracle of medicine a lot of the time.
Yeah.
And you've got a foal with problems.
Yeah.
It might be fine, and I have to keep saying that. The doom merchant. I don't mean to be that.
No.
But you've also
you
collected
should
enough
look out for
research
these
to
things.
show that they're not always fine, that
They're
you
not
can
always
say
fine.
that. Yeah.
Yeah. That there are some
We hope the foal is, but
Yeah, so there are some outliers that will just go on and thrive, but the other ones need a lot of care to tick all those boxes, and have that real holistic care to support all those systems that are kind of compromised by it. But yeah, absolutely. The question is
look out for them. Yeah,
just what do you do? What do you do when you're looking at a horse that might spend? Well, it won't be viable to be ridden, or if it is ridden, it might be dangerous. It might be difficult
too.
in its behaviour.
Stress responses.
The stress responses make it a risk to ride because it's uncomfortable and sore and in pain. And then how comfortable? And then you've got a horse that's like you can say, okay, well, it could be a paddock ornament. Yeah, but it's going to be an uncomfortable paddock ornament. And is that fair to keep this animal alive? So I can see it's just this research that you've done has really revealed also a can of worms as well about the welfare ramifications of these horses long term.
Yeah. And I think in that sense, this is very much piloting these ideas.
Yeah.
I did get some of them published and I'm very pleased about that. But
yeah,
it's not, I know, I'm always expecting pushback on this. It's interesting because I'm outside the veterinary profession, and my supervisor is, my main supervisor is a vet, a research vet. So it's where am I going?
Yeah, your pushback. So what pushback do you reckon you might get?
Discussed. That's what I'm trying to get to.
Yeah, I think so too.
It's something to think about, and I really hope other people might feel like researching some of these things.
Yeah, no, absolutely. Because what you've highlighted is something that needs awareness. It needs identification early to give these horses a chance. And we need to start tracking or, identifying these horses and tracking them of how they go down the track.
Yeah. And at various points I have had huge validation from a couple of reproduction vets.
Yeah?
Yeah. Which just blew me away.
So they'd already started seeing some patterns.
They'd noticed, and just the early bits of my research just fed in there.
Yeah. Well, it's normally the people at the coalface or the ragged edge. I met this lovely guy, Peter Cowell. I call it the coalface. He calls it the ragged edge, and I've totally stolen that. That when you work there, you do get to see patterns, especially when you're working with similar animals through the same thing, and you get to know them and know the family and know them and work with a lot of them. You do get to see patterns, and that's a legitimate piece of evidence to tip science off for research.
Yeah, and they were both research involved as well, so they had that thinking going on.
Yeah, no, fantastic. Kat, I'll let you ask another question.
How might developmental immaturity influence their behaviour under saddle? Which I feel like we've kind of touched on, but do you want to give a specific sort of answer for that one?
Yeah, and again, there's so much variation. The way they're raised, the way they're managed, the way they're trained. What sort of worries me, and has always worried me, is that if some of these guys are small, they'll get passed on to young people.
Yes.
And I think, this might not be so good.
Yeah.
But I've not come across any that have. But sort of behaviour under saddle. I mean, you're obviously, once you get past the training issues, there's the reactivity, there's the spookiness.
Yeah.
And not all of them. Some of them can be slow. Cognitively as well.
Yeah.
That's something I've not really looked into. But I definitely had, when you're looking at horses with thoroughbred breeding, and I just came across a lot of Arabians for various reasons. There's a lot of people, in the endurance section.
Yeah. Well, they also breed
a lot of their Arabians at home. And it's sort of those horses that express their reactions a lot through physical movement. There's a lot more going on.
Yeah.
So there's as well, I've got to say.
Yes. Yeah.
Yeah, and there was somebody gave me a reason for that, and I can't remember it, but it's a different something about gestation.
Yeah, okay. There's a concept, right? I don't know if you've heard of the worry cup concept. So the worry cup concept or the stress cup actually comes from human PTSD. talk and education. But there's a horseman in America called Harry Whitney, and he kind of it's a good analogy or metaphor to talk about how much stress a horse can handle. So there's concept of the worry cup, and things can clog up the worry cup until the worry cup gets full, and then it overflows, and that's when the horse just is reactive. So there can be things like confusion or discomfort or the time of day or fear or phobia or whatever can clog up the worry cup. So what you've really done is a good case is that when you've got these developmental things, which of course this extra struggle in the horse, basically these horses have a small little worry cup that they can't cope with
really easily.
Yeah, so that it easily overflows. So it become, like I said, brushing a horse's tail and, you're on the wrong side, because they've been slow to process that movement there. So their worry cup is so tiny, they've just got this hair trigger to where they flip into reactive behaviour instead of being able to think their way through it. So, yeah, it's very fascinating.
And some of them for sure take a longer time to come down.
Yes, that was good. That's
the negative feedback loop.
Yeah.
Cortisol,
Yeah, so some have too little cortisol, some have too much, and then you have the differing kind of responses that can happen from that.
So
but
that training, they made longer to.
Yeah, the inability to regulate back down. Because with the nervous system, that is something that you do learn. Like that interesting research in children. This is very fascinating research with children, that if you spent your first, just say you got a choice of a life you would live. You got a choice that you can live your first 2 weeks in a really bad situation, and then for the next 12 years you live in this paradise, this beautiful situation. So you got that. That's choice A. Choice B is that you have the best 2 weeks ever, and then you have a rubbishy 12 years. Which would you pick? So from the research, would you believe the child that had the first 2 weeks will have greater resilience and all that type of thing, even though they've had a shitty rest of the 12 years, because that first 2 weeks is so fundamental to the nervous system being able to regulate itself, etc. It's fascinating. So this is very similar. Yeah.
Yeah.
Yeah. So, Kat, you got any other questions? I think we've exhausted our questions.
I think our list is well and truly done, Shelley. I like your list, though.
So what we can ask, Jane, can you please tell us how people can find out more about you? So besides the research, I want to point out that you're a very good body worker, and you have a very good website with a lot of good blogs on it. It's called The Horse's Back. Am I correct?
I've got a blog. Yeah,
you've got a blog, and people should read it because there's
lots of really good stuff on there, and there's lots of stuff that I referenced.
That was an accident. I just started it. It kind of happened.
Yeah. So it's thehorsesback.com.
That's thehorsesback.com. Yeah.
Yeah. So you can check out Jane's work there. But then, Jane, I think this book is really important for all the breeders out there, the people that are considering breeding their own horse, and there's a lot of them. Cat breed her own horse. So where can we get access to this book?
Yeah. So it's going up at the end of February. It is digital. It's an ebook.
Yeah.
I do want to do, I just had to get it out there. It's a year late already. So, only a year
away.
Yeah. So I've got my page on Facebook, which is Equine Health Works, and attached to that, I've set up a group that's been sitting there for 2 years called Managing the Miracle Foal. If you go to Amazon and type in your search bar Miracle Foal, the book will come up, and it's on pre-order at the moment. So but it's easy to find. This is the whole point. And I'm setting up a website called miraclefoal.com.
Yeah.
Which I'm hoping to use as a resource. And it's just basic at the moment, but put case studies on there. So I'm kind of setting up this whole sort of what do you call it, an ecology ecosystem, that's it, around it, to make it, you can find it, you can read it, we can talk about things. I think a lot of people, I've had lots of messages since I first wrote about it on the blog, on the horsesback.com. people saying, "You've described my horse. Thank God, I've never heard this before." And I've had quite a lot of messages like that. And people say, "I've been looking for information. I've got this premature foal." It's that whole what comes next thing.
Yeah.
And that information just isn't happening at the moment. So I'm trying to set up this. But
No.
you'll find it.
Yeah, because people are just ignorant. Until I read your work, I was pretty ignorant about it. So now I'm not.
It's naivety. And then when you know better, you can do better.
Yeah. So I've got to ask Kat, your mind been wandering to Roger?
Yeah, definitely.
Do you know anything about how he was born, anything like that? Because Roger, very reactive horse, but has arthritis young, right? Roger's ticking all the boxes, even with the head, the shaped head and the small stature.
I love the shape of his head.
I know, he's very cute. I'm just listening to Jane going, Roger, tick, Roger, tick, Roger, tick, Roger, tick. And it's like, I bet Kat's mind's going, you've read him. You'll have to ask Heidi.
I went to Roger and then I was like, oh, that's fine. We're past that. He's going, okay. But then think about lots of client horses as well. Like all those ones that are super tricky. And
really good
to the trainers and the breakers. And they're their training doesn't seem to tick along at a sort of normal sort of pace. Like they kind of learn things very well as well.
There's always a lot of questions around them. It's kind of they don't quite make sense,
Yeah.
And what's going on?
Well, it also ties in nicely with we met a really fascinating guy from the US. His name's Kerry Thomas, and he's done a lot of studying of wild horses, like decades and decades of studying wild horses. Yeah. And he's developed a theory of herd dynamics. And his theory is based on what he labels sensory soundness or their reactivity level, which all connects how he does it. Looks at it actually does combine. It's actually it's almost like a behavioral or a herd kind of implication on body asymmetry, reactivity, and all these things. But he sees it in action of what it does. So he's kind of his theory of it's not herd structure, it's herd roles, and it's all got to do with basically the ability of horses' nervous systems to regulate and their level of independence. It's really fascinating. But it's interesting that it ties in because with wild horses, of course, they're open to drought and cold and a whole lot of factors that are in there which will put it at play. And then, in other bodywork stuff or anatomy stuff or whatever looked at as well, it's also tying into that. But never have I contemplated, which is good, the impact of having a premature foal or a foal that hasn't formed, but they're still not mature, even though they've met the number of days. I just think that's so fascinating.
Wow. In my head, Sally, I'm like, it's nature's way of providing safety to the herd because it's got the weak link that they can feed to the lion.
Yeah. So that's what Kerry says is that they're all knitted together from strengths and weaknesses. The more reactive horses are like the trip alarm system, whereas the horses that regulate better, they're able to assess whether that's nothing or not.
But they're also the first ones that are going to attract predators and stuff to them. And
his framework's very fascinating because it's not based on dominance or anything like that. It's actually based on sensory processing abilities and and the difference between stallions and mares and bachelor band. Anyway, it's quite fascinating, but it actually falls in quite interesting. You can see that link there if you want to be creative. So the horse's back is your blog.
Yes.
Managing the Miracle Foal is the book that comes out at the end of this month.
Yeah.
You're locked in now. Locked in. And what was the name of your Facebook page to follow?
Equine Healthworks that's just my practice. So I put stuff on there.
And do you still practice? Are you still treating horses?
Yes, I am.
Whereabouts what areas
do
you
New
serve?
South Wales. Yeah. So I just moved down the road from Armidale.
Nice. There's a lot of good.
So
I know I'll be able to.
A lot of horses around here.
So I know a lot of good people up there. I'll be dropping your name to them. Anyway, Jane, thank you so much for this amazing chat. I think, and now people, I hope by the end of this podcast, they're going, yeah, no, that's really fascinating stuff. I never thought about that either. And thank you so much for actually getting this idea, getting out there and getting boots
mad
on.
Enough to...
No, it's fabulous. This is passion. That's passion. Do a PhD. Got to be slightly passionate about it.
Also, you've got a long fingernails, so you just hang on.
Hang on as you go down when you realize, oh God, what have I done? This is all my results. Yeah, and then you climb out of it. Anyway, you've climbed out of it with some really cool stuff. So super appreciate all that effort you put into and your supervisors and, getting it all together. So congratulations for that. Thank you for doing this work and presenting it to the equestrian world. And we'll say goodbye and thank you so much for joining us.
Thank you for having me. Bye-bye.
Thanks, Jane.